Are you over 70 and find yourself worrying more about your health than ever before? Does the fear of losing your independence, of becoming a burden, cast a shadow over your golden years? What if I told you that some of the very medical tests you're taking to stay safe could actually be pushing you toward the exact outcomes you fear? We're about to uncover a shocking truth that Dr. Henry and his colleagues are hesitant to discuss, revealing 5 routine checkups that can do more harm than good. Before we dive in, please do me a favor and hit that like button, subscribe to our channel for more life-changing content, and comment below with where you're watching from. We love connecting with you, and you might even get a shout-out in a future video. Today we're navigating the complex world of modern medicine, not with fear but with wisdom. Our goal isn't to dismiss doctors, but to empower you to become an active partner in your own journey toward longevity and well-being. The conversation around healthy aging is often dominated by a test for everything mentality. But true health is about more than just numbers on a chart. It's about preserving your quality of life, your joy, and your precious independence. We're going to explore how sometimes the most powerful tool for promoting your health isn't a scanner, but a deeper understanding of your own body and the simple, effective, healthy habits you can build today. Let's begin with a test that sounds incredibly sensible on the surface, something many of you have likely experienced. We're talking about the bone density scan, or the DEXA scan. It seems like a no-brainer, right? A quick, painless scan to check on your bones. You walk in, you walk out, and you get a score that tells you if you're at risk for fractures. It's presented as a cornerstone of preventative care for seniors, a simple step towards ensuring your physical stability and continued happiness. But there's a side to this story that often remains untold. A hidden narrative that can create a cycle of fear and unnecessary treatment. Here's the thing that Dr. Henry wishes more people understood. Some degree of bone loss is a completely natural part of the aging process. It's as normal as getting wrinkles or finding a few more gray hairs. Our bodies change, and that's okay. The problem with the DEXA scan is that for many seniors, especially women over 70, the results almost invariably show some level of lower density. This finding, often labeled osteopenia, isn't necessarily a sign of impending danger, but it's often treated as one. It's the beginning of a path that can compromise your well-being instead of protecting it. Once that report lands on the desk, the pressure to do something can be immense. Many well-meaning physicians, like Dr. Henry might have in his earlier days, immediately reach for the prescription pad. You might be prescribed powerful medications like bisphosphonates, drugs designed to halt bone loss. But here's the kicker. These medications come with a list of potentially severe side effects. We're talking about things like esophageal irritation that makes swallowing painful, and even a rare but terrifying condition called jawbone necrosis, where the bone in your jaw can literally start to die. This is a high price to pay for a condition that might not have posed a significant threat in the first place. The most startling part is that for mild bone loss, the very reason many seniors are put on these drugs, the actual benefit is shockingly minimal. Studies have shown that these medications have a very small impact on reducing fracture rates in this demographic. One major study found it reduced the risk by less than 0.5% over 5 years. So you're exposing yourself to significant potential side effects for a nearly negligible benefit. It's a trade-off that dramatically affects your quality of life without substantially improving your prospects for longevity or independence. Is it truly worth it? Let me tell you about a wonderful woman, a friend of mine, let's call her Rose. At 76, she was an avid gardener, full of life. Her routine DEXA scan showed mild osteopenia. Her doctor immediately put her on one of these medications. Within months, she developed severe jaw pain and acid reflux. Her happiness plummeted. She stopped gardening. After a conversation with a more holistic-minded Dr. Henry, she stopped the medication and instead focused on healthy habits. She incorporated weight-bearing exercise like walking with light weights and revamped her nutrition to include more calcium and vitamin D. A year later, she was back in her garden, stronger and without a single fracture. Rose's story is a powerful testament to the fact that for many seniors, the best defense for bone health isn't a pill, it's lifestyle. Consistent, gentle exercise does wonders for maintaining bone strength. Think resistance bands, Tai Chi for balance, or even just dedicated daily walks. These activities not only support your physical structure, but also boost your overall well-being and happiness. Nutrition is the other half of this powerful duo. Ensuring you get enough calcium from leafy greens and sardines and sufficient vitamin D from safe sun exposure or supplements is a far more natural and effective path to healthy aging. This approach puts you in the driver's seat of your own health journey. It's about nurturing your body, not fighting it. It's about choosing healthy habits that offer a multitude of benefits, better balance, stronger muscles, and a more active mind, over a medication that carries heavy risks for a tiny reward. True longevity is built on these daily choices that enhance your quality of life, not on a number from a scan that instills fear and pushes you toward treatments that might ultimately diminish your independence. So, the next time a bone density scan is suggested, I encourage you to have a deeper conversation with your Dr. Henry. Ask about the real risks versus the benefits for someone your age. Discuss the power of exercise and nutrition as your first line of defense. It's your body, your well-being, and you have the right to choose a path that prioritizes your overall happiness. If this is making sense to you and you're feeling a bit more empowered, please give this video a quick like to help spread the word. Now let's move on to something even more intimidating, something that touches on one of our deepest fears as we age, the loss of our minds. I'm talking about getting a brain MRI for mild memory loss. When we start misplacing our keys more often or forgetting a name here and there, it's natural for a wave of panic to set in. The fear of dementia or Alzheimer's is profound, and in that moment of fear, a doctor might suggest an MRI to see what's going on. But this seemingly proactive step can open a Pandora's box of anxiety and unnecessary medical interventions. The uncomfortable truth is that for mild age-related forgetfulness, a brain MRI is rarely the helpful diagnostic tool people hope it will be. In most people over 70, these detailed scans will simply show what a brain of that age looks like. Some slight shrinkage, maybe a few white matter spots. These are often completely normal, benign changes, the brain's equivalent of wrinkles. However, seeing these abnormalities on a report can be terrifying. It triggers a cascade of fear and can lead to a battery of further, more invasive tests that may not have been needed at all. This is exactly where we can get into trouble on our quest for healthy aging. The problem is that once these spots are found, it's hard to unsee them. This can lead to a spiral of anxiety, specialist appointments, and even invasive procedures like spinal taps or exploratory biopsies, all based on vague findings that were likely harmless. One huge review found that while the vast majority of scans on seniors showed some kind of abnormality, only a tiny fraction, about 3%, were linked to an actual treatable condition. This means countless seniors endure emotional turmoil for no reason, which is detrimental to their well-being. Speaking of building powerful habits and understanding your health on a deeper level, many of you have asked for a resource that puts all this information in one place. That's why we've put together our comprehensive ebook, Wellness and Aging: Valuable Tips for Seniors. It's packed with practical advice on nutrition, exercise, and maintaining an active mind to support your longevity and independence. It's the perfect companion to these videos. We've made it super accessible, and you can find the link to get your copy in the first pinned comment below this video. Let's consider the story of George, a retired engineer of 74. He was sharp as a tack, but started worrying because he was forgetting names more often. His Dr. Henry sent him for an MRI, which showed those typical age-related white matter changes. George panicked. He became convinced he had dementia and his world shrank. He stopped driving, he stopped going to his social clubs. His quality of life nosedived. But when he was reassessed with a simple, paper-based cognitive test, his score was well within the normal range for his age. His active mind was still very much there. The real solution for George wasn't another scan, it was education and reassurance. His new Dr. Henry took the time to explain that the MRI findings were age-appropriate and not a sign of impending doom. They shifted the focus to lifestyle interventions, things that genuinely support brain health. They worked on improving his sleep, ensuring he was properly hydrated, a huge factor in cognitive function, and introduced brain games and social activities to keep his mind engaged. Within a few months, his memory stabilized, his confidence returned, and his happiness was restored. So, what's the takeaway here? Unless there are Severe, sudden neurological symptoms like seizures, a rapid decline in function, or a dramatic personality change, a brain MRI is often not the best first step for mild memory concerns. A much better and less fear-inducing approach is a simple cognitive screening test. It's an effective tool that evaluates memory, attention, and problem-solving skills without the risk of false alarms and unnecessary panic. It's a smarter path to understanding your cognitive health and maintaining your independence. This empowers you to focus on what truly matters for healthy aging. Keeping an active mind, engage in hobbies, learn a new skill, read, do puzzles, and stay socially connected. These activities are the pillars of brain health and contribute immensely to your overall well-being. Don't let a picture of your brain scare you into a smaller life. Instead, focus on the vibrant, engaging, healthy habits that will keep your mind sharp and your spirit bright for years to come, ensuring a future filled with happiness and purpose. All right, brace yourself, because the next test on our list is one of the most common procedures given to seniors, and you've probably had it recommended to you. We're talking about the cardiac stress test. When you mention feeling a bit more tired than usual, or some mild chest tightness, this is often the go-to diagnostic tool. It's meant to spot blocked arteries by monitoring your heart while you walk on a treadmill. But after 70, this test can often sound a false alarm, leading to a cascade of interventions that do more harm than good. The biggest issue with stress tests in seniors who don't have clear symptoms of heart disease is their alarmingly high false positive rate. Some studies show that it can be as high as 40%. That means that in 4 out of 10 cases, the test suggests there's a serious problem when, in fact, there isn't one. This false alarm is what triggers the next, far riskier steps. It's a slippery slope that can quickly escalate, jeopardizing your health and well-being unnecessarily. I know this can be a tough pill to swallow, but if you're finding this information valuable, please consider subscribing to the channel so you don't miss out on future insights. Once a stress test comes back positive, even if it's a false positive, you're put on a conveyor belt. You'll likely be sent for follow-up tests like an angiogram, where a tube is inserted into your arteries. If they find even a mild narrowing, which can be common and stable in older adults, you might be pressured into getting a stent placed or even undergoing bypass surgery. These are highly invasive procedures with serious risks, including bleeding, kidney damage from the contrast dye, and long, difficult hospital stays. All this from a test that was wrong in the first place. A major study in a top cardiology journal found something astounding. More than half of all the stents placed after a referral from a stress test were put into patients who had no significant symptoms and gained no real benefit. Their survival rates didn't improve, and their quality of life didn't get better. What they did get were higher rates of complications and prolonged hospitalizations. It's a clear example of how a seemingly routine part of a health checkup can lead to a cascade of events that detract from rather than add to your longevity. Think of Raymond, a 75-year-old retired postman who loved his daily walks. He mentioned to his Dr. Henry that he felt a little more tired going up hills. A stress test was scheduled just to be sure. The results were ambiguous, so he was sent for a catheterization. A mild narrowing was found, and a stent was placed. That night, Raymond had a severe reaction to the contrast dye and developed acute kidney problems. He spent nearly a week in the hospital. The fatigue on hills, it never changed because it was never a heart problem to begin with. He was simply an older man who needed better hydration and to pace himself. This is a classic case of treatment, chasing a test result rather than the patient's actual condition. Raymond's quality of life and independence were severely impacted by a procedure he never needed. If you're over 70 and not experiencing classic cardiac symptoms, like chest pain that comes on with activity and goes away with rest, or significant shortness of breath on exertion, a stress test might be a risk you don't need to take. Your well-being is too precious to gamble on a test. With such a high chance of being wrong, there are safer, smarter options. A simple resting EKG, which looks at your heart's rhythm while you're still, can provide valuable information without the risks. Another excellent, underutilized tool is a coronary calcium scan. It's a low-radiation imaging test that specifically looks for the buildup of dangerous plaque in your arteries. It's far more direct and much less likely to push you into a procedure you don't need. These alternatives are better, aligned with a philosophy of healthy aging that prioritizes safety and quality of life. So, the lesson here is to be an advocate for your own heart health. Engage in conversations with your Dr. Henry about your real day-to-day experiences, not just fears of what might be. Focus on the proven healthy habits for heart longevity: a balanced diet, regular exercise, and managing stress. These are the cornerstones of a strong heart and a long, happy life. Don't let the fear of the unknown push you on to a path of unnecessary and risky medical procedures. Your health is in your hands. Now we're getting to a test that many people dread, but believe is an absolute necessity for healthy aging. I'm talking about the colonoscopy. You probably didn't expect to see this one on the list. For decades, it's been hailed as the gold standard for colon cancer screening. However, the conversation needs to get more nuanced, especially when we talk about seniors after age 70, and almost certainly after 75. The risks associated with a routine screening colonoscopy can begin to outweigh the benefits for many people. The first hurdle is the preparation. It's notoriously harsh. The strong laxatives required to clean out the colon can cause severe dehydration, electrolyte imbalances, and dizziness, which increases the risk of falls. For older adults, this prep can be particularly taxing and can even lead to kidney issues. Then there's the sedation used during the procedure itself. In seniors, sedation carries added risks to brain function, potentially causing confusion or cognitive decline that can linger long after the test is over. These are not minor inconveniences. They can significantly impact your well-being and independence. Beyond the prep and sedation, the procedure itself isn't without risk. While generally safe, complications like bleeding, intestinal tearing or perforation, and even heart rhythm disturbances can occur. A major 2019 study that followed over 1 million Medicare patients found a startling risk-to-benefit ratio for those over 75. For every 1,000 colonoscopies performed, it was estimated that only 2 lives were saved, but over 20 people experienced serious complications. That's a 10-to-1 ratio of harm to benefit, a statistic that should make us all pause and think. Your health journey should be about maximizing quality of life, not taking on such unfavorable odds. Let's pause here for a moment. This information can be a lot to process, and it might go against everything you've been told. If you're finding this discussion helpful and eye-opening, please let us know in the comments. We read every single one, and your experiences help the entire community learn and grow together. Another critical point is that even when polyps are found, many of them are small and slow-growing. In an older adult, removing every tiny polyp can sometimes cause more immediate harm, like bleeding or perforation, than leaving a slow-growing one alone. The U.S. Preventive Services Task Force, a leading authority on screening, now officially recommends stopping routine colon cancer screening at age 75 for most people. For those between 76 and 85, it should be an individual decision based on overall health, life expectancy, and past screening history. Consider the story of Dana, a vibrant 73-year-old grandmother. She had no symptoms, no family history, and had 2 previous clean colonoscopies. But a new, young Dr. Henry, fresh out of residency, insisted she get another one just to be safe. During the procedure, a small polyp was removed. That night, she experienced intense pain and was rushed to the hospital with a bowel perforation. She spent 9 days recovering, lost a significant amount of weight, and her vitality was deeply affected. The procedure that was meant to protect her ended up severely harming her quality of life. This is a heartbreaking example of how by-the-book medicine, without considering the individual patient, can go wrong. For someone like Dana, with no symptoms and a history of clean scans, another colonoscopy was almost certainly unnecessary. There are safer, non-invasive alternatives for continued screening in this age group. The best option is often a stool-based test, like the FIT test, which you can do in the privacy of your own home. It's highly effective at catching most significant cancers. The FIT test requires no harsh prep, no sedation, no time off work, and no risk of procedural complications. It's a simple, safe way to continue monitoring your colon health and maintain your peace of mind. It's a perfect example of a smarter approach to healthy aging, one that uses the least invasive means possible to achieve the goal of longevity. It respects your body and your time, allowing you to focus on the healthy habits that bring you joy and happiness, like spending time with family or pursuing your hobbies. Before you agree to another routine colonoscopy after 75, have a frank discussion with your Dr. Henry. Ask about your personal risk-to-benefit ratio. Ask about safer alternatives like stool-based testing. Remember, you are the expert on your own body and well-being. The goal is not just to live longer, but to live better. True healthcare is a partnership, and you are the most important partner on the team. Your voice and your preferences matter immensely. And now we've arrived at the #1 checkup on our list, the most overused, potentially harmful, and fear-driven screening test marketed to seniors today. This is the annual full-body CT scan, often sold as part of executive health packages in private clinics. It's promoted as the ultimate way to catch cancer and other diseases early. But the shocking truth is that for a healthy, asymptomatic person, this test is like searching for a needle in a haystack with a stick of dynamite. It's far more likely to cause harm than to save your life. The primary and most significant danger is the massive dose of ionizing radiation. A single full-body CT scan can expose you to a radiation dose equivalent to somewhere between 200 and 500 chest X-rays. For older adults whose cells are more vulnerable, this is not a trivial exposure. In fact, a recent modeling study suggested that the dramatic increase in CT scans in the United States may now be responsible for up to 5% of all cancer cases, putting these scans on par with alcohol as a cancer-causing factor. The irony is staggering. A test marketed to prevent cancer may actually be causing it. The second major problem is the high likelihood of incidental findings. Your body, especially after 70 years of life, is full of harmless quirks, tiny nodules in the lungs, benign cysts on the kidneys or liver, harmless calcifications. A high-resolution CT scan will find them, and the moment they are seen, a red flag goes up. You're plunged into a world of anxiety, follow-up scans, more radiation, and invasive biopsies for things that would have never caused you a problem. This journey takes a huge toll on your mental well-being and quality of life. Let's talk about Marcus, an incredible 80-year-old who still taught martial arts. He felt fantastic, but was convinced by a private clinic to get a senior elite checkup that included a full-body scan. The scan showed a tiny 3mm nodule in his lung. This set off a chain reaction. He was sent to an oncologist, then for a PET scan, and finally underwent a needle biopsy. The result? It was benign, completely harmless, but the biopsy itself collapsed part of his lung, leading to a painful hospitalization and a 2-month recovery. All for nothing. His independence was shattered for months because of a test he never needed. Expert medical bodies, like the American College of Radiology, are crystal clear on this. Full-body CT scans should never be used for general screening in asymptomatic adults. There is no proven benefit, and there is significant potential for harm. The smarter, safer approach to longevity and healthy aging is to listen to your body. If you are feeling well, maintain your regular checkups with a trusted Dr. Henry who knows you, and only undergo tests that are clearly indicated by specific symptoms you're experiencing. If you have unexplained weight loss, a persistent cough or other concerning symptoms, then a targeted CT scan of a specific area makes sense. But scanning your entire body without a clear reason is a deeply flawed approach. It replaces the wisdom of clinical medicine with a blind technological hunt that often creates more problems than it solves. Your health and your peace of mind are far too valuable to waste on fear-driven screenings that could leave you far worse off than when you started. So there we have it. 5 checkups that seem helpful on the surface but can actually cause harm, especially once you're past 70. Modern medicine is a powerful gift, but it's not perfect. It's a tool that must be used with wisdom, discernment, and a deep respect for the patient's overall well-being. Sometimes the bravest and smartest thing you can do for your health is to say no, or let's wait and see. The ultimate path to healthy aging, true longevity, and lasting happiness isn't found in a scanner or a lab result. It's found in your daily choices and healthy habits. Stay active in ways that bring you joy. Fill your plate with nourishing, real food. Prioritize deep, restorative sleep. Nurture an active mind, and cultivate your social connections. These are the pillars of a vibrant life, the things that truly preserve your quality of life and independence. Always ask your doctor, what happens next if this test finds something? If the path forward is unclear, or if the risks seem to outweigh the rewards, it's time to pause and reconsider. As we close, I want you to reflect on this for a moment. How does it feel to think of yourself not as a patient in waiting, but as the powerful curator of your own well-being? What's one small step you can take today, not out of fear but out of self-love, to enhance your health? We would be so grateful to hear your thoughts and experiences in the comments below. Your story could be the spark of inspiration someone else needs to hear. Thank you so much for joining us on this important journey today. If you haven't already, please subscribe to the channel and click that notification bell so you never miss these vital conversations. And be sure to check out our next video, where we explore the simple nutritional changes that can have the biggest impact on your energy levels after 60. Until next time, be well and choose your path to health wisely.